I'm Peggy Peck, MedPage Today, reporting from New Orleans at the American College of Cardiology meeting. It's not often that you hear words like historic and landmark and practice-changing bandied about to refer to one trial, but that's happening here, and the trial is the partner trial. To describe that trial, here's Dr. Craig Smith from Columbia University, who was a surgeon who was the principal investigator of this trial.
This was a trial comparing what is currently the standard of treatment for a relatively common and lethal condition, aortic stenosis, comparing surgical treatment for that condition to a new treatment which avoids surgery and uses a catheter-based technique for placing a new valve.
In the trial, the survival at 1 year for these very high-risk elderly patients was a virtual dead heat, although there was a slightly higher stroke risk in the percutaneous arm. This is how Dr. Smith put it.
Well, anytime you can replace open heart surgery with something that doesn't require open heart surgery, to show that it's as good seems like a win, I think, to the man on the street and to most people.
And that certainly was the way most of the doctors here described it.
I believe it is practice changing. Of course, these devices are available in Europe, so we already have considerable information coming out of Europe, but this is the first randomized prospective trial head-to-head comparing a surgical approach versus the catheter-based approach. So in that regard, it really is a landmark trial. It will be a game-changing.
The challenge, of course, will be in implementation.
Yeah, as physicians, we're obligated now to make sure we use the appropriate utilization criteria to select patients who should undergo TAVI versus surgery, and to make sure that we work with our payers, our professional societies, to make sure we have the appropriate data being entered in databases so we can track outcomes systematically and not believe just the very first data coming out from a randomized trial.
So, history was made here today, or so it seems. But how that history will be integrated into daily clinical practice remains to be seen. In New Orleans, for MedPage Today, I'm Peggy Peck.